Welcome, everyone, to Day 5 of It's a Guy Thing Summit, and I am excited for today and our theme, which is the stress of sex. And I am honored to have Dr. Bill Petok on the phone with us to bring his wisdom, his many years of wisdom. Dr. Bill has been working within the fertility industry for 25 years, and he is an active participant and contributor to the wonderful organization, the American Fertility Association. And so Sarah is on the line also, and we're truly honored to have you with us today to discuss this very important topic for men and for families. So thank you so much for your time.
Well, it's really a pleasure to be here, and I'm pleased to be part of a program that is focusing on male factors.
Because I'm sure you're aware also that there really isn't a lot of conversation or attention focused on male factor within the fertility world or fertility area. And given that, I think the statistic, isn't it, 40% of fertility issues are related to male factor? Is that the right statistic?
That's a statistic that is frequently cited. Sometimes you see as low as 35, but 40 probably is more reasonable. And if you throw in the amount that is combined, both male and female factor, where both partners have a role, you might say that the contribution of men to infertility might run as high as 50%. So
right.
It is significant. And you're right, not only does it not appear in the professional literature nearly as frequently, but, and I think more importantly in terms of awareness, is it doesn't appear in popular literature. You can read People magazine or any other magazine and find out about a relatively high-profile woman who has utilized fertility services, either donor egg or a surrogate or IVF, and you can name them. And you'd have a hard time naming a man who has similarly been interviewed and talked about it. About the closest thing was a few months ago, Jimmy Fallon was interviewed talking about the stress that he felt as he and his wife went through infertility. And I got very excited about that, thinking that it was going to be a disclosure on the part of a very high-profile man about his own issue, but it turned out that was not a male factor issue. So I got disappointed in that.
I am too with that, and what I have found having these amazing conversations with gentlemen who have come forward, like Greg Wolf, who wrote the book, Making Love to a Plastic Cup, and Mark Sadaka, who talked about what
right.
to expect, she isn't expecting, and Jonathan Bolt, Shooting Blanks. These men are brave and present and thoughtful. And what I found, Doctor, was that within my coaching practice, within my privilege of walking the path with women and couples, it was a mirror image of the emotional bell curve that the women experience. And my heart broke for men because it was locked away with protection and shame. That and it's so important for the male counterpart to have this outlet, to have a way of releasing the stress. And
that's
in your in your practice, have you had experience with men, coming to the breaking point? And my hope would be is how do we talk about this before they get to the breaking point?
Sure. Well, I think there are two things. First of all, I want to say I was very fortunate to do a program with Mark Sadaka, and I thought his way of writing about the problem was unique. You don't see often a male voice being that sensitive about what he was dealing with. And I think that's an important factor when you think about the fact that men do have feelings about their wives when they are experiencing a female factor. But to get back to men in particular, how do you break through? I think one of the things is there has to be a greater recognition in the community at large that male factor infertility does take place at a significant level. And having said that, more programs like this, more public awareness issues, greater focus on the fact that this can affect a man just as easily as it can affect a woman. You know, if you look historically about why there is not greater awareness, I think you have to go all the way back to the original artificial insemination work that was done before the turn of the previous century. And it was decided that it was possible to do donor insemination, but the woman was anesthetized. Her husband didn't know that a donor sperm was being used, and those present at the procedure agreed that they would never disclose what had taken place. And a baby was delivered, and it was, healthy. And they went. Well, 30 years later, somebody wrote about it. And so there's been a unspoken rule, if you will, that you don't talk about male factor infertility because of the things that you mentioned about the shame and so on and so forth. And that it's better to keep these things a secret. I think as we become more aware of the disadvantage of keeping secrets, particularly when children are involved, and the advantage of acknowledging things that happen in a normal way. I mean, male factor infertility takes place with such a high rate that one could say it's normal to see men who are dealing with this, in the same way that it's normal to see women who are dealing with this. In the same way it's normal to see people who have diabetes. It's normal to see people who need glasses. These are normal problems that people encounter in everyday life. Not everyone, obviously. But so the more we normalize it, the better we are in terms of reducing shame and stigmatization. If you look at the sort of the psychological and sociological makeup of this, there's a difference in having children for men and women. You could say that femininity in some ways is defined by mothering and nurturing. That's one large component of it. And masculinity doesn't have that. Fathering, well, to be a father doesn't take as long as it does to be a mother. Or, let's put it this way, to create a child as a father doesn't take as long as it does to create a child as a mother. And once insemination takes place, dads are there as support partners, but they're not actively involved. And so we tend to look at creating a child as being a 9-month process for a woman and not so much for a guy. The other thing is that men are we think of children as something we produce rather than nurture. Not to say that there aren't nurturing men. I think there are many, many nurturing men, but that's not the context that we think about ourselves in. And that obviously is changing as men are experiencing greater responsibility and desire to participate in child rearing. So I think it's a slow evolutionary process. And I've probably lost the train of where we started, so why don't you help me out and bring me back?
I don't think you lost the train. I think we're on the train, just going down. I love referring back to Mark Sadaka, because what he said and the notes that I took was such a great way of saying is that I think he said, if I find my notes, the marriage, your marriage is the conception. No, let me see what he said. I had it here.
Okay.
But
he said the conception
is
was the marriage and the raising of the child, or it was the wedding. The conception is the wedding.
Conception is the wedding. I have it right here. Conception is the wedding, and raising the child is the marriage, and to focus on the marriage, and that was that's what you are talking about. That men focus on the raising, the marriage of the child. And with the fertility issues in the forefront is a what you just explained, being a female job at the moment. We're us as a female are focused on that.
Right.
So if I was to step back and ask you a question, so what I think I heard you say is that unconsciously there is a legacy burden that because of in the past when it was required to have an heir or procreate, it was done in secrecy. So in a way, it's the same. It's that lineage that is still pervasive about men and what that means. I mean, within the conversation with men, one of the things I think it was Eric spoke about was really not wanting another man's sperm in your wife.
Right. There's a sexual connotation there. And that is, it strikes some men as, that's another man having sex with my wife, and so it's adultery in a metaphoric sort of way, and of course that's not true, but for a lot of guys that's the image they get, and it's creepy is not a technical term, but I think for a lot of guys they get creeped out by it. As opposed to thinking about, okay, well, I want to create a child. I want to create a child with this woman. I don't have the necessary component. Can I get over the fact that I'm not going to have a genetic connection, but that child is going to be connected to me because I am his or her parent? And it's interesting when you interview kids who are created by third-party reproduction techniques, they don't think about the donor as their parent. They think about the people who raised them as their parent.
Right.
And it's very clear. So, but it's a leap. And I've sat with guys who have had a very difficult time. In fact, I'm working with a couple right now where adoption was more palatable for him because, well, there are two reasons. One was because the idea of somebody else's sperm creating a child just didn't work for him. And he's adopted, and he liked the fact that he had a good growing up and wanted to offer that to somebody else. So he's not a fair comparison, but there are just some guys who have a very difficult time with the notion of using someone else's sperm. In the same way, women can have a difficult time with using another egg, but I think less so. Because
I would agree with that, Doctor. In the couples that I've talked to, I've also heard a lot of people tell me that that embryo donation has also been a preferred path, just because it's that you get over the insemination fears, I guess, and it still allows the woman to have a natural kind of a pregnancy, and it's kind of a compromised place that I've seen couples get to also.
Yeah, I could see that. You were alluding to the transmission of property as being one of the components for a man. And, of course, there are that goes back to biblical times where only men could inherit property. And so if a man did not have a male heir, why, his property would go nowhere. And so he had to do that. Hence, you have laws where men could divorce women just by saying, I divorce you, so that he could get a male heir and try again. I think we're a bit more enlightened today and have a different understanding of the notion of family. But, of course, third-party reproduction really challenges our notion of what constitutes a family because we're able to create families in different ways today. So,
right.
Yeah.
So if we address that in the male way of coming to embracing the different ways of creating your family, Doctor, my family is I have a son who's turning 16 and a daughter who's turning 11. So I was 2 decades ago, it was a different experience going through fertility as it is now. The options,
sure.
We were grateful for our options, but they're not as vast. They weren't as vast as they are now. And
absolutely.
So my question to you would be, what are 3 ways, if we could just focus on communication,
right.
Communicating what is important for you and what you need, and, what I feel and what I need, focusing on those 2 questions. And then also circling back into how does the stress of this affect a man, the stress of the sex, or sexlessness, not having sex.
Yeah.
So,
right, okay.
So go ahead.
Well, so I think, the first part is, how does one communicate? These are basic communication issues, and I don't think there is a big difference between fertile couples and infertile couples. Everybody has their own communication style, and some work better than others. If you have a better communication style with your partner, you're probably more able to talk about really difficult issues like fertility. And that's because these aren't everyday conversations that we are brought up to talk about. We're good at talking about lots of other things, but the presumption that most people have is that they will grow up, fall in love, get married, have babies, and become grandparents someday.
Right, and normally, and typically, this is it could be the first huge marital conflict that is presented within a relationship, a marital relationship, because of what you just said. We thought we were going to get married and have a kid.
Yeah, but even before it's a conflict, it's a crisis, okay? Because it's it's a family crisis. It's a family building crisis. It could be a conflict, but it might not, because a couple might say, okay, we're problem solvers. We have this problem, and this is preventing us from creating the family we want. So in order to do that, we need to explore our options. So we'll go to talk to an expert, and the expert says, here are the things you can do. Now we have to decide which of those are we comfortable with. And if you have a good problem-solving style, well, you'll be able to do that. And if not, you may want to seek out advice from someone who is more expert in that, preferably somebody who knows a lot about fertility-related issues and is not just shooting from the hip. So there are certainly couples who do better with all kinds of problems to be solved than with others. So that's one thing. Now, the second part of that question had to do with stress and sex. Am I remembering correctly?
Yes.
Okay.
The stress of it on a male, So you identify this conflict and or crisis that might be in conflict or not.
Yeah.
I'm saying conflict is a crisis, and then then you're thrust into this world, if you so choose to be within the ART, assisted reproductive technology, and then there's such structure around it, when you can have sex, when you can't have sex, when, and now the roles are totally new, because for me personally, it was really about just getting sperm. It wasn't even about,
Yes, a husband becomes a sperm delivery system.
Yes,
yes.
Yeah, and the change of that dynamic, the stress that causes.
So one of the things that when I work with couples under those circumstances that I try to emphasize is that if you are in the early stages of treatment, that might involve when you time intercourse so that you're looking for high probability conception times. Well, the window is 3 to 5 days. That means in most months there's at least 25 other days when you can be physically intimate. And so the recommendation is don't limit your sexual activity to just those 5 days. Because if you think about what are the purposes of sex, well, certainly one of them is procreation, but another one is relationship enhancement. And if you omit the relationship enhancement part and only focus on the procreation part, you're leaving off an awful lot of time when you can be intimate and can have pleasure when you can't get pregnant. And so, it makes sense to not stop being intimate during those other times. And it frankly takes, I think, some effort and some ability to discuss intimate relations with one another so that you can do that. And hopefully medical professionals who are working with couples under these circumstances are advising that this is a good idea, that we take a more normal view of sexual relations, that these are things that people do, that couples engage in because it feels good, not just because it makes babies. So that's one thing that I think becomes very important. Now, when you move into more focused treatment, where you are, frankly, engaging in sexual activities around some doctor's schedule, that changes things. And a lot of guys, and women as well, report that when they're having what they refer to as sex on demand, it's as though there was a third person in the bedroom with them, the doctor, right, or part of it, or one of his staff. And just like you said, sex is about I need you to inseminate me. Not I need
right.
you to love me. Not I need you because I love you. It's you're a sperm delivery system now, and
right.
that's what I need from you. We have to educate people to think about things a little bit differently. But I think there's a medical provider responsibility there, because as healthcare providers, we can be aware of these things in ways that our patients are not, and it is up to us to provide them with that insight so that they don't make the mistake that some couples make, which is you're just there to deliver sperm to me. And by the way, I'm not chastising you at all. But because I think it's normal to when you want a baby really badly, it's normal to be focused on that aspect of it, and
right.
to not pay attention to the other aspects of intimate relations.
Well, I think also within the conversations that I have with the women and men who participate in group coaching or also private one-on-one coaching, it's the stress of that. When you're in an active role of an IVF,
mm-hmm.
you are told to abstain here,
yep.
participate here, and then, the gentleman, ejaculation can't occur 2 to 4 days before, whatever the statistics or the
exactly
per case. And then
yep.
what I found, and I'll just speak personally, is during that time
sure.
with my now ex-husband, after each treatment, we would slip back into a normal quote unquote for us relationship
yeah.
pattern, because in my mind I didn't want to know the difference between if this child was conceived within the medical office or in our privacy. And so I think, unbeknownst to me, and I also feel this is for the other women that I have the option, the privilege of speaking with,
mm-hmm.
that there is a blindness, like we talked about. You get these blinders on, and it's all, you're focused. You're focused on what you need to do each day. You're focused on your shots
right.
and your ultrasounds and your levels, and it is a different experience for the male who can compartmentalize this experience in their life and go off to work and
yep.
have quote unquote normalcy within their day. So what you said is wonderful insights, and I think maybe circling it back to communication about, in your experience with working with men, how can the other partner hear them clearer, or how can we understand what the male needs during these high intensity times of when you're actually in a cycle?
Well, I think it actually requires the man to be able to say something about what he needs, because despite all my years of training, I never once got a course in mind reading, and to be able to read somebody else's mind is a very, very difficult, if not impossible, thing to do. So, a woman can ask a partner, what is it that you need? He may not know, because he may not have thought about it in those terms. And I think that the key here is don't get frustrated with him because he doesn't know how. He may not have a vocabulary for this. It's certainly... Go ahead.
Well, one of the things, personally, that happened between, during that time was, we assume the other person knows what we need, or we assume the other person needs what we need, right, at that moment.
Right, and that's, of course, a mistake. Yeah.
Yes, it's a big mistake because you're assuming, do unto others as you'll have done to you, but that's not what the other person needs. You're projecting, what you need. Yep. And what ended up happening is within my experience, we came to the point of, oh my goodness, our marriage is going to be, and I took out an index card and I wrote down 3 things that I needed from my partner at the time, and I asked him to do the same thing, and we continued to do that for 3 months, and it was a feedback loop because instead of feeling that we were not thriving as our role as a wife or a husband, it was like, wow, this is wicked easy, because the other person had a non-direct way of communicating. And I don't know, Doctor, in your experience, do you feel that men need an indirect way of telling what they feel?
Some men do. Some men can be very direct. I think it really depends on the man and the woman who's listening. I think it's too easy to simplify men and women and say that all men are this way and all women are that way, and because it's just not accurate. That many men are a certain way. So many men have a fine way of expressing themselves, and others not so much. So part of what makes marriage functional is being able to understand how the other person thinks. You don't have to agree with how they think, but to be able to understand how they think really is very helpful, because then it helps you to predict a little bit about what's going to work. And I think in these times, when you're undergoing all the stress that infertility and its treatment can involve, it is really understanding how the other person wants to be cared for. We all want expressions of caring from our partners. Some of us are more in tune with what we want those to be, and some are less in tune. And we all know, some of us know very well how we want to be cared for, and we sometimes get confused and think that our partners want to be cared for the same way. And that's not necessarily true. The example I like to give is that if I know you like ice cream, and I bring home chocolate ice cream every single night for you, and you say, yeah, but my favorite flavor is vanilla, I haven't been doing you any favors by bringing home chocolate.
Right.
But if I know you like chocolate and I bring home chocolate, I'm your favorite guy because I really know what you want. So sometimes you got to ask. I don't know what you want. What is it that you want? Again, mind reading not part of most people's repertoire.
Right. So doctor, you talk about problem solving, and I think a lot of guys can resonate with, I want to be a problem solver. But the area of emotions and understanding what I need, and also understanding how to communicate what I need, some guys don't have a lot of tools or a lot of tricks or a lot of ability to kind of self-identify those things or to be able to communicate. Do you have tools that you could share?
Sure. But I think before I get to that, let me talk about the fact that what you say is very true, that men are trained to be problem solvers. And when you're presented with fertility as a problem, it's a problem that's typically out of your ability to solve. It's not like a light bulb that needs replacing or a faucet that's leaking. It's now something which you don't understand. And moreover, because women tend to be the focus of treatment and men are not always included in that treatment, when guys do show up and sit in for appointments with their wives, they don't often feel comfortable asking questions because they may not understand her reproductive system or their own reproductive system that well. Women have a distinct advantage here in that most women do something on a yearly basis to take care of their reproductive health. They see an OBGYN. Most men do not do something on a yearly basis to take care of their reproductive health. Men tend to see urologists when they have a problem. And
right.
For most
and Dr. Eisenberg on Monday talked about that. Men do not go to the doctors unless they're shot. And that was what we were talking about. You know, the tweet. Yeah. Don't wait till you're shot. You need to go yearly and get checked out, just like your female counterpart does. And
you're right.
The reluctance to go to the doctors to take proactive or primary care.
Yeah. Well, it's it is not necessarily a reluctance. But it is it's not something that gets trained into us. And if you go back and you look at what happens when men hit puberty and when women hit puberty, it's very, very different. When women hit puberty, they learn about feminine hygiene. They learn about reproductive health right away if they've got good mothers or good health classes. And there are all kinds of indicators that there's something they need to do now, and it has something to do with a cycle which takes place every month and is going to go on for the next 40 or so years. When men hit puberty, the experience is very different because what they discover is if they touch themselves in certain ways, it feels really good. That's it. Nobody has a conference with them and says, all right, now we need to do this and now you need to do that, and it just doesn't happen. So the awareness is totally missing. So it's not just that we don't take good care of ourselves, is that we don't have biological events which set up a situation where we learn how to take care of ourselves. And it's not the fault of any man or any parent. It's just the way biology is structured. So it would be helpful if men, for example, had pediatricians who said, oh, by the way, it'd be a good idea for you to do, when you leave my care when you're 19 or 20 or whatever it is, it's a good idea for you to have a yearly physical or every 3 years, whatever the current standard is, because there are parts of your body which you'll want to take care of, and to have an open and conscientious conversation. For those men who have any kind of sex education in high school or in college, typically what happens is you learn about plumbing, and you learn about, this is true for women too, you learn about plumbing, and you learn about how not to get pregnant and how not to get a disease. You don't learn about how to get pregnant, which is just as important as how not to get pregnant. And so education could be improved in this regard. There are certain roadblocks to providing comprehensive education in this area, and those are more about personal beliefs and values. But I don't think healthcare is a personal belief or value. I can't imagine anybody would say healthcare is not important. So we have a lot to do in teaching both men and women, but more so men, about comprehensive and good health care for themselves and how to be participants in that. Does that get at some of what you were asking about?
No, it does, because it talks to a greater, the aha is it's the systemic issue from the, from childhood for men, that is really not offered about this is you, this is the awareness of you. Did you know you have these hormones going on in your body, and because you triggered puberty, this hormone level's up, and what does that mean for you, and what is that feeling like, and what could you be feeling? It goes back to the mask in society that it goes back to the beginning of your conversation, the secrecy, the not in the openness about men and men's body, which is brings sadness in me for that. The way that you eloquently explain that is that the disconnect of the heart and mind and body, for men in that way.
Yeah, we're very good at teaching women about breast self-exams. We're not as good at teaching men about testicular self-exams. And if you think about it, that would be important just from our conversation here with regard to fertility, because cancer is certainly something that happens to people that interrupts their fertility, and they need to do something, obviously, about it. And it becomes important then for physicians who are treating male cancers to talk about fertility preservation early on in the treatment. But how do we identify early? Well, we learn. So women, very good training in breast self-exam. Men, not such good training in testicular self-exam. And both. Well,
not only that, it would also bring awareness to what a varicocele could be. Given that the doctors this week have shared that it's a familiar link. Did you ask your father? Have you asked your uncles? Have you asked your brothers? Do they have a varicocele? And that leads back to the openness and the awareness of that within the family. I mean, it is one of the first questions that you're asked as a female: is there breast cancer in your family?
Sure.
And are you aware of that? And so, just bringing into awareness, what is a varicocele? How does that happen, and when does that happen, and if is it in your history? Is it in your family history? Goes back to the empowerment. Goes back to the comfortability of who you are within this body.
I would also add that women, we have a lot of feedback in our monthly cycle. We have discharge amounts. We have pain. We have regularity, all these kinds of signals, and that's kind of a nice biorhythm, biofeedback system that kind of gives us some data about where we are in terms of our health and our fertility and et cetera, and it gives us a reason to talk to a doctor or ask our girlfriends or ask our mother or whoever about what's going on. Men, those kind of symptoms don't show up unless there's really a problem.
That's correct.
The lower sperm count or poor motility or something like that isn't going to show up. You're going to have to wait until you get all the way to, erectile dysfunction or, loss of testicular mass or something that's like, okay, holy crap, there's really something going on here.
That's correct. It's a very different, you don't have the regular monthly feedback that a woman gets. And the other thing that it brings up is having parents who are comfortable talking about these things with their children. Most of us can recall the conversation we had with our parent when we learned about sexuality, and for some it was incredibly comfortable, and for others it was incredibly uncomfortable. The more we become comfortable with notions of sexuality as a culture, the more we do our children a service by helping them be comfortable with what is normal functioning.
It's interesting in my since I've started this, I've gotten a lot of young men who are, not yet in relationships, early 20s, and they do come up to me and ask me what is normal. And even online you'll see it a lot. What is normal? What's normal size? What's normal quantity, volume of semen, all these things. They do want to have some sense of, am I normal? Am I okay? Will I be able to have kids someday? My pediatrician also brought that up, that, he gets a lot of young guys asking him, how will I know if I can have kids? Am I able to have kids? So I think it is something, but then, when men don't get that feedback, or the answers to those questions, or they learn that it's kind of shameful to talk about, then they just bury them. And then I'm not going to ask what's normal or if I'm normal. I'm just going to assume I am normal because, you know, it hasn't fallen off or, you know,
right.
whatever. It hasn't. So.
Yeah, no, I think you're right. Learning, you know, having a health community that talks about normal, having a parental community that talks about normal is very useful. These are normal questions that men are having greater and greater awareness of. I have I know one particular fellow who talks very openly about how he's known for more than a decade that he wants to have children, and it is the most dear thing to him. And he also says, I don't talk about it to a lot of people because it's not what I am comfortable doing. You know, we shut the door in my office, and it's private. And he knows that I can't discuss it with anyone because I'm bound to confidentiality. And it would be nice if he were able to have a conversation with someone else who could offer him comfort and an ear that was compassionate so that he could do it in a different way, if you know what I mean.
Yeah. So, you know, can we turn this to kind of addressing to the women maybe, what are some tools or some strategies that women might be able to use to create a safe place for men to get in touch with those things that they've buried? Because I think it's going to take someone some time to get in touch with their true feelings on sexuality and on their true feelings about fatherhood, about children, about, you know, their own, you know, destiny.
Sure. Well, so, you know, you raise a very good question, and it's something we see an awful lot in working with couples, and that is that as they go through treatment, let's say, for example, it is female factor, and, you know, they're both upset about it, but they're not upset about it in the same way at the same time. And so she might be more upset on one day and he on another, and one of them is concerned that the other one doesn't care as much about it. When in fact nothing could be farther from the truth. They both care a great deal about it.
They're caring differently.
And they're on a different schedule.
Yeah.
And just because you're not in sync with the other person doesn't mean you don't care.
Right.
So again, there's an important responsibility if you think about healthcare as a collaboration between provider and patient. There's an important responsibility on the part of providers to say, here's what some people normally experience. One of you will be feeling bad on one day and the next on the other day, and you will be concerned that the other one doesn't feel the same as you do. Nothing could be farther from the truth. Or for patients to say, I am concerned about this, and I'm concerned that we're out of sync in the way that we show it to each other. Is there something I need to know so I can understand my partner better? From the point of view of women, I think it's important for women to recognize, and I know they do, that men aren't the same as them. We do things differently. I do a talk on differences between men and, you know, gender differences between with regard to fertility, and I have this great slide, and it's entitled "Shopping for a Pair of Jeans at the Gap." And it shows a mall, and you see a red line that comes in the door, walks across the hallway and into the Gap, buys the pair of jeans, and traces itself back out. And it says, man, 27 minutes, $39.95, pair of jeans. And then it's got a blue line, and it says woman. And that blue line goes all over the entire mall, goes in and out of 27 stores, goes into the Gap, buys the pair of jeans, and says, woman, 2 hours and 35 minutes at $39.95 for a pair of jeans. $29 for a purse, $17 for socks, $50 for a pair of shoes, total cost, whatever it is. Right? The point being, we just do things differently, and different isn't bad. It's just different. Now, you have to appreciate that men and women do things differently. If you can do that, then you're farther ahead because you understand just because your partner demonstrates how they feel differently than you do doesn't mean that they don't feel the same way. Just they have a different vocabulary, a different way of expressing it. And that's sometimes a tough concept to get because we so want our partners who we love to be just like us. But, of course, we didn't marry them because they were just like us. We married them because they were enough different that it enhanced our lives, because we'd get bored being married to ourselves. So there's a part, so you have to start with that sort of level of understanding that different isn't bad, and then make it clear that I want to be helpful in the way that you want me to be helpful, which goes back to what we were talking before about caring. If I care for you in the way that I want to care for you and it's not the way you want to be cared for, it's not terribly helpful. But if I can know what you need from me, and if you can tell me, then I can give it to you. And if you can't tell me, that's okay. Think about it, and when you figure it out, let me know. Now, for some people, that may not be satisfactory. You could be in a pressured situation. So, for example, I'm sure you've seen this an awful lot. Somebody feels as though they have to make a choice immediately about what path to go on in terms of fertility treatment. And there are some pressures, Yes, we have a surrogate and she's available. We have to make a decision we want to use her. Or we have a donor and we have to make a decision we want to use him or her. For male factor donors, typically you don't have to make a quick decision. The sperm is in the bank. For egg donors, it's a different story, although with banking that's changing. But there may be some pressure to do things quicker, and that may be outside of someone's comfort zone, and to appreciate the fact that, this isn't the way you normally do things, but I think we have, let's talk about how we can do it differently this time. Is a way to get started on that conversation. And frankly, you can't solve every problem the same way all the time. So that becomes problematic because not every opportunity is going to present itself in the same way. Some will allow you the freedom and the leisure to do things slowly. Others, not so much. And sometimes we have to operate quicker than we would like or pass on that opportunity and be comfortable with the fact that we passed on the opportunity.
Well, I love that question. How can we do it differently? And within our comfort zone, how can we do this differently when you have to do it differently? I love the open question. How can we make this better? Yeah. How can we do it differently? I love how, because not only does how open up possibilities between two people, but it also, I feel, opens up possibilities within the universe, because it's you're asking for help, basically. How can I do this? How can we do this? And that is so that's so powerful. There's just the how. How are you feeling? How can we do it differently? Being curious. Being curious behind the how.
Right. No, I think you're making a very good point. All too often, what I see couples doing is saying, "Why can't you?" And that's not a question to which you will ever get a satisfactory answer. But how can we? If it's a problem to solve, then we have to enter a dialogue about how can we solve it. And you're right. It creates possibility. It creates opening. It creates a sense of hope, which is important to have under these circumstances.
Well, the line that I use and coach or suggest is, how can we make this better?
Sure.
and that is such a personal question. You know, how can you make this better for you, and how can I make this better for me? Gives such wonderful information. You know, how can we make this better?
Yep.
And
I mean, in talking about people kind of handling things differently and being on different timings and cycles and whatnot, do you ever draw analogies from kind of how people deal with grief, in that, you know, there are such radical expressions of grief, and you know, it's the same thing, and I think there's so many parallels that I can feel from what you're saying.
Oh, I think you're absolutely right about that. There are a lot of parallels there, and in fact, you know, when we talk about common reactions to diagnosis of infertility, grief is one of those things that typically takes place. And people do deal differently with grief. Some people need to cry. Other people need to immerse themselves in something that keeps them busy, and one way is not better than another. It's just different. We do get some stereotypes. You know, women are, and I'm using air quotes here, supposed to cry, and real men don't cry. Well, I think that's fine, but I don't know that it's true with a capital T. Some women do cry, and some women don't. And some men don't cry, and some men do, for a variety of reasons. Some men cry when they're happy. Some men go to a wedding and bawl their eyes out because it's a happy occasion, and they're thrilled because they know the people who are getting married, and they're very happy for them. And some men go to a wedding and wish it was over sooner rather than later.
And some men go to the bar.
Yeah, right. When can we get a drink? Does this thing have to go on forever? Right. Just as an aside, I had the good fortune of attending a wedding of a colleague's son who married an Indian girl, and I'd never been to a Hindu wedding before. And I asked an Indian friend of mine, what should I anticipate? And she said, about 4 hours, and bring reading material. And I thought, okay, this will be interesting. It'll be very, very different. And it was moving in a different way. I didn't break into tears. But that's besides the point. So, grieving is going to be different for the person. And one way is not better than another. It's just different. And different isn't bad. So
circling back around, are there some kind of practical things that couples can do maybe to start a healing process, to start restoring intimacy, to find a new normal, or to define their own normal as they're going through this?
Well, I think, one of the things you can do is understand that this is a disruptive experience, and that many people feel out of sorts, or as though their sense of groundedness has been interrupted, and that they need a break. They need a change of focus. They need to go for a walk, go for a drive, do something different, and it's going to take them a bit before they're going to be back in the saddle, as it were. And that's normal, so it's good to be normal again. So that sort of recognition, I think, becomes important. To be able to say, look, I'm ready to get going, but I know you're not, so tell me when you are, because I want to be as accommodating as possible of you, and I don't want to push you to do things quicker than you're ready. I do want to regain a physical closeness with you. I want to do it, though, on a timeline that allows you to feel comfortable with it. If sexual activities have been interrupted, what's a good way for us to resume slowly? We don't have to dive right back in. Sex is a big wide chain of behaviors. It's just not intercourse. There's There's hugging and kissing and snuggling and fondling and all kinds of other things that go along with that. So it's important to be able to have those conversations in a reasonable way.
That reminds me of a quote. When I was at the Fertility Planet, they had a session on this, and one of the panelists said, spooning can lead to forking. It was probably the funnest takeaway.
Yes, I like that. That's very good, yes. And so for the gastronomes out there, they can pay attention to that. I think that's cute.
That's wonderful.
It's true.
Well, thank you so much for this wonderful conversation.
Well, thank you.
It just brings us back to the awareness of a change in the way the health system and the health education is given to men and women together, and how empowering it would be from an early age to cultivate an environment that a young person can say, you know what, I want to be a father. I'm looking forward to that, and this is what's happened in my body, and wow, maybe open conversation. So, if we just ask you, we've been asking all week long for one little pearl of wisdom, not one little pearl, but an important pearl that you could leave us with.
Well, I think it's very important to be educated, to have knowledge, and to have knowledge about your partner. What is it that, go back to what we were talking about before about caring. How does your partner want to be cared for? Because if you are going through a situation like infertility treatment, it's going to be stressful. And how can I support you? Conversely, how can you support me as we go through this process together as a team? Ask the questions and listen to the answers, I guess, would be the pearl to take away from it.
Wow, that sounds so easy.
Yeah, really.
And
well,
so profound.
If it were easy, I wouldn't be able to make a living, right?
Well, it sounds. I mean, how easier can it get? Ask the questions and listen to the answer.
Right.
If we could all do that with ease, that
would be great, wouldn't it?
We would live. Yeah.
Yeah, absolutely.
Well, thank you so much, Sarah, and I appreciate your time. And thank you, Sarah.
It's my pleasure.
For being with me too.